lesson will describe a scoring tool that is used to assess NAS symptoms. You should note that there are other scoring systems in use, and some hospitals may use modifications. We are going to focus on the Finnegan Neonatal Abstinence Scoring Tool, or FNAST. The FNAST was developed in the 1970s by Dr. Loretta Finnegan to aid healthcare workers in the assessment of babies exposed prenatally by opioids, primarily heroin. This tool contains 21 signs and symptoms of opiate withdrawal that are scored prior to, during, and after an infant's withdrawal period. Each scoring item has a numeric value that is used to determine the severity of withdrawal. The total score will aid in decisions for pharmacologic and non-pharmacologic treatment intervention. It is important to obtain a detailed drug history from the mother regarding her drug use. The FNAST is specifically created to assess for signs and symptoms of opioid withdrawal and not withdrawal from other drugs such as stimulants. Scoring should be initiated within 2 hours of delivery, and the infant is to be scored every 3 to 4 hours. Scoring intervals are determined by the score. Score every 4 hours if the score is 7 or less. If a score is 8 or greater, the scoring should be completed every 2 hours until a score of 7 or less is obtained for a 24-hour period. Withdrawal is dynamic, and any signs or symptoms seen during the 3 to 4 hour scoring interval needs to be documented on the tool. A consistent score time should be utilized either before a feed or after a feed.
Some score items on the FNAST must be taken into consideration for the preterm infant, since the preterm may have issues with immature respiratory, gastrointestinal, and oral motor systems. The respiratory and feeding score items may be due to prematurity and not withdrawal from drugs. Also, the infant who is experiencing respiratory distress from transient tachypnea of the newborn TTNB in respiratory distress syndrome, RDS, or meconium aspiration syndrome, MAS, has an increased respiratory rate from lung pathology, not drug withdrawal. Therefore, newborns with these diagnoses should not be scored for increased respiratory rate. When pharmacotherapy is not indicated, an infant may not experience opioid withdrawal from prenatal exposure. Consider ceasing the scoring when the infant has not had scores over 7 for 24 hours.
It is recommended that pharmacological treatment be initiated if the infant receives a total score of 8 or greater on 3 consecutive scorings, or the average of any 3 consecutive scores is 8 or greater. The total score is 12 or greater for 2 consecutive scoring intervals. The average of any 2 consecutive scores is 12 or greater. When pharmacological therapy has stopped, scoring should discontinue for 3 days. If the infant's total score does not reach a value of 8 or greater, scoring may be discontinued. Of note, in a recent study by Holmes et al., babies with scores over 8 in the first 36 hours prenatally exposed to nicotine were not started on morphine. It was thought that early symptoms were the result of nicotine exposure in addition to methadone or buprenorphine prenatal exposure. It is suggested that nicotine withdrawal may be causing early symptoms as opposed to opioids. Therefore, pharmacologic treatment with morphine may not be indicated.
This may be difficult to see, but it is a single-page FNAST with 21 items and a total score added at the bottom of the score sheet. Other areas to note on the paper form are locations for medications at the top and signatures of the scorer at the bottom. EHR systems will have their own format. The FNAST items are grouped in 3 categories. The first category of symptoms includes central nervous system disturbances, including crying, sleeping, moral reflex, tremors, muscle tone, excoriation, myoclonic jerks, and generalized convulsions. The second category on the FNAS form is metabolic, vasomotor, and respiratory disturbances, including sweating, fever, frequent yawning, mottling, nasal stuffiness, sneezing, nasal flaring, and respiratory rate. The third detailed category on the FNAS form reflects gastrointestinal disturbances. These include excessive sucking, poor feeding, regurgitation, projectile vomiting, and loose and watery stools. If you are participating in a simulation, you will be able to access the FNAS on an iPad device. On this screen, you will notice the symptom categories on the left and the history on the right. Further instructions will be provided on how to enter to scores on this device.